Now we are talking about policy and legislation, the development and implementing. And this is relevant, especially in the technology-dependent countries and in developing countries. And the questions are why are needed, who is in charge, and the sustainability of the process. Next. Well, the main reason is the population protection at the country level. And for this, technologies need to be assessed, their needs of regulation of medical products, and is necessary management of health technologies. And don't forget about the health facilities infrastructure. This has an impact in the health service provision to the population because that need to be with equity, quality, and cost effective. And also is reflected in the health system operation. And for that, we need an organization framework which means the level of complexity and interaction, reference and contra-reference also need to be very clear duties and responsibilities, specifically for the one dealing with the technology, and of course, finances, and is necessary monitoring and accountability of the process. Next. The question is who is in charge or leading the process, the actors. And this has been in the past 20 to 30 years as leader, all the professionals in the health technology field, mainly the clinical engineers. So it's the responsibility of all of you attending these events and your colleagues. But that is as a person. We need also professional organizations, clinical and biomedical engineering societies that advance this field. You are, again, as a group, the responsible. Also, government, ministries of health, ministries of science and technology, and nowadays also ministries of communication. But there are also stakeholders, the health sector institutions that benefit of the advance, the academia that train the resources, and the health insurance organization that handle all the system. Also, there are interest groups, public policy groups, and legislative groups. Also, international organizations. We are very familiar with WHO, PAHO, and IFMBE, CED, and IEEE. Next. But the important is the sustainability and continuity of all these processes of policy and legislation. For that is your responsibility, the participation. You need to get involved in the public policy decision-making processes and forum. That is the next level for our leaders. Also, it's necessary to promote awareness and advocacy on health technology. Also, to promote national strategic alliances between public, private, and academic partnership, coordination with scientific and professional societies, work with international agencies, organizations, and NGOs, and also it's necessary to develop institutional capacity building on infrastructure and technology and the country level, linked to networks of institutions and experts as we are doing it today, and participating in global initiatives. IFMBE CED is an example. Next. So now we will present success stories in this field, the perspective of health technology policies and legislation in the Latin American and Caribbean region by Rosana Rivas, the perspective in Japan by Takamiro, and in Colombia with Andrea Garcia. Now, for the following 14 minutes, the floor or microphone is on Rosana Rivas. Please, Roxana.